Hello, this is Dr. Parikh, uh, and I hope that you guys are all settled in. The schools have started back again. If you are a parent or grandparent, I think you're getting a little breath after a busy summer. And hey, today what I really wanted to kind of talk to you guys about is dental emergencies. Every so often, one day or other is sometimes you may go through a dental emergency, and it's beneficial to know what to do in a dental emergency. So there's typically three types of dental emergency calls that we get. They typically fall in these three categories. Number one is broken tooth or a filling. Number two is basically a knocked out tooth altogether. The tooth completely gets knocked out. And number three is just a toothache, good old toothache. Alright, so those are the three categories. Again, broken tooth or a filling. Number two, knocked out tooth. And number three is a toothache. Now, let me kind of go over all these with you. So if there is a broken tooth or a filling, typically what happens is, how would you know? You would typically know depending on how big a fracture is. If the crack is small, the only thing it's going to do to you is probably it's going to rub against your tongue, or it's going to rub against your cheek, and it's going to kind of irritate you. Well, if it's a back one. If it is a front tooth with a broken, then obviously apart from tongue and lips bothering it, you're going to also have aesthetically it's not going to look nice. So when this happens, obviously you're going to give us a call first thing, and we'll go ahead and have a look at your teeth. And it might be as, to be honest, it can be as simple as just smoothing it out. Sometimes the chip is so small, all we really need to do is just polish it. It is so small sometimes that if we add it, the filling may not even stick, it might just pop off. So sometimes, that's the best case scenario. All it is just a small little chip. You come in, we kind of polish it, and you're all done. Now say if the chip gets bigger and bigger and bigger. So if it is a little bit bigger than that, it can be easily fixed by a filling. You come in. Nowadays we have tooth colored fillings, and it's going to look really nice. It matches really well, and you're going to be in and out in no time. Now, if it is bigger than just a small crack, right? If it is a little bit bigger, the bigger chunk of a filling fell off, or something big happened, like half of the tooth is missing now, then filling is probably not going to be, something is a good option. Because if half of the tooth is missing, or I would say half or more than half of the tooth is missing, then you're looking at something that's not gonna, the filling is not gonna cut it. We're gonna have to do a crown or a cap. You heard that term. What it is basically it covers the whole tooth. So what we do in that scenario is basically we take off about half a millimeter or a millimeter of a tooth all around, and make a temporary crown, or we can go ahead and do a same day visit crown for you, and we can basically get a crown and get you on your way. So that's also kind of an easy way. So those are the three things that could happen when you have a broken filling or or a cracked filling. Now let's look at the second option, or the second dental emergency that you may encounter, and that is knocked out tooth. Now this typically happens with the teenagers or kids while they are playing in the park, or they're in the game, and then they are not wearing their mouthpiece, or whatever the scenario is, or something they jumped off of the monkey bar and they just knocked their tooth, or whatever. That could be the scenario, and now the whole tooth is out. So the patient comes in with the tooth in the hand. But if this is the scenario, now this is very important. Now at that time, as soon as this happens, whether you are in the park or you're in the school, you try to take the tooth, wash it with regular water, and put it in a cup of milk. Okay. Now if it happens in a school, then school typically has a special saline solution that you would put in, and that solution is made up of material that's supposed to keep the tissue around the tooth alive for a long time. So once the tooth is out of your mouth, it is very critical that you see the dentist as soon as possible. There has been some studies that if you take 1 hour before you see the dentist, what are the chances of tooth gonna last? If you see the dentist after 2 hours, what are the chances it's gonna last? And if you see the dentist after 3 to 4 hours, what are the chances of tooth to last? To summarize it, the sooner you see the dentist, the greater the chance of the tooth to last. So what we do in this scenario is, you bring the tooth to us with us. If you are able to kind of put it back where it belongs, right in the play field, that's fine. But if you're kind of nervous, you don't want to do anything of that sort, get it clean, put it in the solution that the school gives you, or put it in a cup of milk, bring it over here, and we'll go ahead and put it back on inside the mouth the way it is supposed to be, and we might have to kind of bond it to make sure it doesn't shift. In this case, we kind of monitor it for about a month and a half to 2 months to make sure if everything is okay. Many a time, tooth sticks back. I would say, depending on how long the time is, if you come within an hour or so, the tooth would stick back on again. And maybe down the line it might need a root canal because the nerves are dead now. We might have to do a root canal to clean out any infection that's present in there. But that's the worst thing that can happen when the tooth is knocked out. Okay, typically it doesn't happen that often. Thank goodness for that. But small little chips happen every so often. All right, so the third option is a toothache. Now, toothache, unfortunately, is one of the most common dental emergency. Toothache can be because of a lot of reasons. Toothache can actually seem like a toothache, but it could originate from the gums. The issue can originate from the gums, or it can originate from the tooth. Typically, it means that there is an infection in the mouth. If there's an infection in the mouth, we need to get it fixed. So you come in our office, and we'll just confirm there is an infection or not. And we may either need to do a root canal to get the infection out of the mouth, or if the infection is too much, we might even have to take the tooth out altogether. If the infection is originated from the gums, which can happen, that is one of the very common thing, that infection originates from the gum. If that is happening, we have to kind of thoroughly clean or debride the area, and then we have to put you on. We'll put some antibiotic medication in there and just have to make sure we monitor it. Stuff like that typically happens, the toothache typically happens because of two reasons. Like I said, gum issue or tooth issue. The tooth issue is when you have a big cavity that is touching the nerve. That means, you're not cleaning your mouth the way you're supposed to. You're not brushing, you're not flossing properly. The gum issue is also pretty much, if you have gum issue, that means if the abscess is originating from gums, that means that you need to get your gums cleaned properly. You are probably not seeing dentists on a routine basis, and we are not able to remove all the tartar. So if you're not seeing the dentist on a routine basis for cleaning, we are not able to clean up all the tartar builds up and causes a source of infection of the gum. Okay. What we do is, like I said, you come in, we clean out the area of infection, and then we try to do some antibiotic treatment, and then put you on a routine hygiene appointments. So I guess I covered all these three things. Like I said, to kind of summarize everything, dental emergencies do happen. Okay, the first dental emergency is broken or chipped filling. The second one is a knocked out tooth, and third one is toothache. If there's anything at all, just give us a call. Okay, we have flexible hours. We can try to get you in as soon as possible. I think I covered everything. If you have any questions, feel free to give us a call. Our office phone number is 916-782-3129. Thank you.